Spending the People's Money. Module 1, Establishing Budgetary Resources. This is the first module in a series of 3 modules on spending the people's money, otherwise known as budget execution. In this module, we're going to talk about the major budget execution events involved in establishing budgetary resources. In the introductory video, we learned that budget execution is all about spending the people's money. The money we spend is called budgetary resources. Budgetary resources are made up of 2 parts. If the resources were made available in a prior year and still remain available for obligation because they were originally made available in a multi-year or no-year account, we call these budgetary resources unobligated balances of prior year budget authority. If they were made available in the current year, we refer to them as new budget authority. Since budgetary resources made available in previous years all began as new budget authority at some point, for our purposes, we're just going to focus on 4 budget execution events involved in establishing new budget authority: appropriations, offsetting collections, transfers, and rescissions. There are many other forms of budgetary resource events we could add to the list, but these are the primary types of budgetary resources you will come into contact with in executing a budget. Well, what's so important about budgetary resources? In our personal lives, we frequently decide to spend money we don't have. We might use a credit card to buy an item we don't have the cash for. We buy cars and homes on the presumption that the funds will come in later to pay for these things. But in the federal government, we can't do that. We have to have a resource or authority before the government can spend any funds. It is almost always unlawful to obligate the federal government in the absence of some resource or authority. If you do, you could pay a fine or go to jail, or both. You may have noticed that I said almost always. That's because there are circumstances such as safety of human life, protection of property, and so forth, under which the government may incur obligations in the absence of some type of authority. You may recall shutdown drills where agencies had to identify the types of emergency activities that would have to continue if the government had a hiatus of funding and had to shut down. But even in these cases, if obligations are incurred, there can still be no payments or outlays for those obligations until some source of funding is made available by the Congress. That brings up one of the first rules of budget execution. You cannot spend money that has not been appropriated. The genesis of this rule is in Article 1, Section 9 of the Constitution. No money shall be drawn from the Treasury but in consequence of appropriations made by law. This section of the Constitution gives Congress the power of the purse, a power that permits them to make the rules about spending federal money. Until after the Civil War, 1870 to be exact, there was no law on the books preventing spending in excess of amounts appropriated. For example, at the beginning of 1870, it was found that the Navy Department had obligated more than twice the amount appropriated by Congress for the construction and repair of ships, and had employed double the force authorized. Consequently, they had practically exhausted their appropriation not even halfway through the fiscal year. This incident so incensed the Congress, they passed the Anti-Deficiency Act of 1870 on July 12, 1870, it became law under President Ulysses S. Grant. It shall not be lawful for any department of the government to expend in any one fiscal year any sum in excess of appropriations made by Congress for that fiscal year, or to involve the government in any contract for the future payment of money in excess of such appropriations. This act, which is codified in Section 1341 of Title 31 of the U.S. Code, tells us that a federal agency cannot exceed an amount appropriated and cannot spend in advance of an appropriation. These are very important rules concerning budgetary resources. Because Congress has this power of the purse, they have to pass laws to provide budget authority, or BA. Budget authority is defined in GAO's glossary of budget terms as the authority provided by law to enter into obligations that will result in immediate or future outlays involving federal government funds. There are 4 forms of budget authority: appropriation, borrowing authority, contract authority, and spending authority from offsetting collections. An appropriation provides the authority to incur obligations and to make payments from the Treasury for specified purposes. An Appropriation Act is the most common means of providing appropriations. However, authorizing and other legislation may also provide appropriations. Borrowing authority is budget authority enacted to permit an agency to borrow money, usually from the U.S. Treasury, and then to obligate against amounts borrowed. In HHS, this authority is used only in loan or loan guarantee programs, and there are only a couple of examples of its use. Contract authority is defined as the type of budget authority that permits an agency to incur obligations in advance of appropriations. Contract authority is unfunded, and a subsequent appropriation is therefore needed to liquidate or pay for the obligations. There are no examples of contract authority in HHS being used to make obligations. Spending authority from offsetting collections is a form of budget authority that permits agencies to obligate and expend the proceeds of offsetting receipts and collections. This 4th form of budget authority is a very important form of budget authority in use in HHS, so we will spend some time discussing it. Given the fact that there's very little borrowing or contract authority in HHS, we will focus our discussion on 2 forms of budget authority: appropriation and spending authority from offsetting collections. Let's discuss each of these budgetary events in order. Our first budget execution event is the appropriation. The appropriation is the most prevalent form of budget authority in HHS. Let's take a look at a sample. Here are a couple of samples of appropriation language for 2 National Institutes of Health accounts. I picked these examples mainly because they're nice and compact and fit on the screen. Many examples of appropriation language are much more complex and take up a whole lot more room, but simple and complex examples all have the same important features of an appropriation. It gives us a purpose for carrying out Section 301 and Title IV of the Public Health Service Act with respect to cardiovascular, lung, and blood diseases, and for carrying out Section 301 and Title IV of the Public Health Service Act with respect to dental and craniofacial diseases. It provides an amount, and it provides a period of availability of the funds being appropriated. But you may ask, where can I find the period of availability in this language? Well, first of all, you should remember that the default for appropriations in annual appropriations acts is 1 year of availability. unless specifically stated otherwise in the Act. There are 3 reasons for this. 31 U.S.C. 1301C tells us that an appropriation in an annual Appropriations Act may be construed as available continuously only if the appropriation expressly provides that it's available after the fiscal year covered by the law in which it appears. The title of annual Appropriations Acts by law includes language that's in this format: an act making appropriations for a fiscal year ending on a specified date. In this example, September 30th, 2016. Just in case you missed reading the Act title, Congress typically adds a general provision telling us that no part of any appropriation contained in this Act shall remain available for obligation beyond the current fiscal year unless expressly so provided herein. For these reasons, appropriations in annual Appropriations Acts are presumed to be annual. That is, they're only available for 1 year, unless the language clearly specifies otherwise. So let's take a look at a slightly different example. Here we can see the purpose and amount, but note that Congress has specifically provided a period of availability in the language for some of the appropriated amount. So the default of 1 year is overridden. In this case, the Library of Medicine at NIH has language making funds available until September 30th, 2017. As this is a sample from the 2016 Appropriation Act, this language tells us that $4 million of these funds was made available for 2 years. Following the same logic as our earlier examples, the remaining $390,664,000 is available for only 1 year. It's important to remember the 3 elements of appropriations: purpose, amount, and period of availability, or time. These are the key components of any study of appropriations law. In a nutshell, federal funds cannot be validly spent unless they meet all 3 conditions established by Congress in appropriating the funds. Appropriations can be made in regular Appropriations Acts, continuing resolutions, supplemental Appropriations Acts, and even in authorizing legislation. But these core principles still apply, and all the budget execution events we're discussing apply as well. From a budget execution standpoint, it really doesn't matter where the appropriation is coming from. The next budget execution event is spending authority from offsetting collections. This is event number 2. Spending authority from offsetting collections is another form of budget authority. GAO's glossary defines offsetting collections as a form of budget authority that permits agencies to obligate and expend the proceeds of offsetting receipts and collections. It's important to understand that since Congress has the power of the purse, this means they not only appropriate funds, but they also get to decide whether an agency can collect and spend funds. Let's do a quick review of Congress's power of the purse. We know that Congress controls the money going out of the Treasury. Article 1, Section 9, Clause 7 tells us that no money shall be drawn from the Treasury but in consequence of appropriations made by law. But Congress also controls the money coming into the Treasury. The Miscellaneous Receipts Statute tells us that anybody in the government receiving money from any source shall deposit the money in the Treasury as soon as practicable. If federal agencies tried to collect money and spend it absent congressional approval, this would be an impermissible augmentation of their accounts. This is a bad thing because spending collections without congressional approval usurps Congress's power of the purse. But when Congress gives their approval permitting federal agencies to collect and spend money in law, this is considered a permissible augmentation. So, let's take a look at some examples of offsetting collections that are permissible augmentations. There are two major types of offsetting collections, each with a federal and non-federal source. There are reimbursements, which are made up of fees from the public or fees from other governmental agencies, that is, intra-governmental. And there are revolving funds. These are also made up of fees from the public, called public enterprise funds, and fees from other government agencies, again called intra-governmental. Each of these requires statutory authority to collect and spend the funds. Let's take a closer look. On the reimbursement side, one type of fee from the public is the user fee. These are fees for services that benefit the payer. And we also have other fees we are authorized to collect for other purposes. Let's take a look at these types of fees from the public. For example, Congress includes authority for the Food and Drug Administration to collect and spend several user fees in their annual appropriation. Examples of these are the prescription drug user fee, the medical device user fee, human generic drug user fee, and others. This authority allows FDA to collect fees from these industries to speed up the approval of drugs, medical devices, generic drugs, and so forth that they want to sell. Congress also provides authority in annual appropriations acts for the Health Resources and Services Administration to collect fees to cover the costs of operating the National Practitioner Data Bank. There are other user fees that you may be familiar with. For example, tolls on highways are considered user fees. The Park Service charges a user fee to enter or camp in a federal park, and so forth. The important thing to remember, all user fees must be authorized by Congress. Another example of a fee we receive from the public is the semi-postal. Personal favorite of mine. Semi-postals are stamps authorized by Congress to be sold at a premium. That is, for more than the cost of first class, in order to benefit a particular cause. Probably the best example is the breast cancer stamp, which was first authorized in 1997 and is still being sold. Since the stamp was authorized, NIH has accumulated over $58 million as of the end of fiscal year 2016. The key point is that Congress gave permission for NIH to receive a share of the proceeds from the sale of the breast cancer stamp and to use the funds for breast cancer research. These are just a few examples of the type of reimbursements we have authority to collect from the public. On the reimbursements intragovernmental side, let's take a quick look at the most prevalent examples. PHS evaluation reimbursements, Stafford Act reimbursements, and Economy Act reimbursements. With PHS evaluation funds, Congress authorizes the Secretary in the Public Health Service Act to spend a percentage of funds appropriated under the Public Health Service Act on evaluation of the programs authorized under that act. While Section 241 caps this at 1%, our Annual Appropriation Act amends this cap to 2.5%. But not only does Congress authorize the use of these funds, they frequently spell out particular amounts in several different appropriations. Note, for example, the SAMHSA language authorizing $21 million for mental health and $79 million for substance abuse treatment from the amounts available under Section 241 of the PHS Act. The appropriations receiving these funds are getting an offsetting collection. It should be noted that Congress is, as the old expression goes, robbing Peter to pay Paul, because any funds collected and spent for program evaluation are coming from other HHS agencies' accounts. The Stafford Act authority permits HHS to be reimbursed generally by the Federal Emergency Management Administration, or FEMA, in the Department of Homeland Security, for emergency services provided during floods, hurricanes, tornadoes, and the like. The Economy Act is the granddaddy of the authorities for reimbursement. This authority was established to prevent federal agencies to contract work from other federal agencies that may have a particular expertise or infrastructure lacking in their agency. Most reimbursable work, sometimes referred to as interagency agreements or IAAs, is done under the authority of the Economy Act. For example, suppose the Administration for Community Living needed to send out a message to the Medicare community. They may wish to enter into an agreement with the Center for Medicare and Medicaid Services, since they would already have a network in place with Medicare recipients. ACL, rather than establish their own network, may simply purchase this service from CMS. CMS would receive an offsetting collection from ACL to pay for this additional work. Let's take a look at some of the language in the Economy Act. Note that the orders must be for goods or services. Payment must be on the basis of the actual cost of goods or services provided. And the agency providing the good or service must incur obligations before the period of availability of the purchasing agency ends. Well, we mentioned there were two major categories of spending authority from offsetting collections: the reimbursements and the revolving funds. So what's a revolving fund? GAO's glossary tells us a revolving fund is a fund established by Congress to finance a cycle of business-like operations through amounts received by the fund. The fund charges for the sale of products or services and uses the proceeds to finance its spending, usually on a self-sustaining basis. Like reimbursements, revolving funds are divided into public enterprise and intra-governmental. There are only a few public enterprise funds in HHS. FDA has a revolving fund for certification that deals with certifying food coloring, and there are loan financing accounts in HRSA and CMS that use revolving funds to manage their credit reform responsibilities. On the intragovernmental side, we have the HHS and NIH service and supply funds, both of which provide business-type operations that are funded by a fee schedule. And CDC has a working capital fund for their internal operations. The Department of Treasury operates a franchise fund, for example, that provides procurement services for the federal government. This fund, called FedSource, is financed by fees charged federal agencies. This is a screenshot from Treasury's Federal Accounts Symbols and Titles, or FAST, publication, listing all HHS revolving funds. Note that Treasury assigns a 4000 series TAFs to revolving funds and lists the authorizing citation for each fund. Public enterprise funds range from account number 4000 to 4499, and intragovernmental funds range from account 4500 to 4999. Let's take a look at one of these authorities, the Service and Supply Fund, for example, to see what it looks like. This particular authority goes back to 1945. Note, for example, that these business-type funds are without fiscal year limitation. That is, they're established as no-year accounts. This makes sense given the need for planning for the future of the business by establishing funds to replace equipment when it wears out, finance lump sum leave, and the like. Clearly, such funds could not operate without the authority from Congress. The third budget execution event we will discuss is the transfer. This can be a confusing concept since transfer can mean different things. So let's take a look at the GAO glossary definition. Note that a transfer may be either expenditure or non-expenditure. An expenditure transfer represents payments or receipts for goods or services. The spending authority from offsetting collections we have been discussing is an example of an expenditure transfer. When an agency is buying a service from another, it's paying them for goods or services. That's why this type of transfer is called an expenditure transfer, because money is transferred to pay for something. The funds received by the agency providing the good or service are an offsetting collection. Let's look at this graphically. Agency A wants to buy a service from Agency B. Agency A has to have the resource in order to pay for this service. They pay some of this resource to Agency B in exchange for goods and services. This additional resource legitimately augments Agency B's resources as spending authority from offsetting collections and is used to provide the good or service to Agency A. Since the amount collected is equal to the cost of providing the good or service, it offsets Agency B's costs. Since we've already covered an example of an expenditure transfer as a resource, that is, an offsetting collection, the type of transfer we want to add to our list of budgetary resources is the non-expenditure transfer. With the non-expenditure transfer, you are simply shifting budget authority from one account to another. You're not paying for a good or service, and the transferring account does not get anything in return for the funds. Using the graphic representation, we can see Agency A actually loses some of its authority to Agency B by way of a non-expenditure transfer. Agency B's resources are increased at the expense of Agency A, and Agency A gets nothing in return. Here's an example of a non-expenditure transfer authority. This authority, which is provided in the general provisions of the annual Labor HHS Appropriations Act, permits the Secretary to move up to 1% of any discretionary appropriation in the Act to another discretionary appropriation, as long as the receiving account isn't increased by more than 3%. This transfer authority reduces the budget authority in the giving account and increases it in the receiving account. Furthermore, there is no good or service provided. It's important to understand the difference between expenditure and non-expenditure transfer, as this distinction can have important budgetary impacts. For example, in fiscal year 2005, prior to the existence of the Office of Medicare Hearings and Appeals, the General Departmental Management Account got an appropriation which stated $50 million shall be transferred to the Social Security Administration for processing Medicare appeals. So which kind of transfer is this? Expenditure or non-expenditure? Well, SSA thought it should be handled as a non-expenditure transfer and insisted that HHS transfer the funds to them. HHS, on the other hand, considered this an expenditure transfer since SSA was providing a good or service, namely adjudicating Medicare appeals. Since HHS required that services first be provided and then paid for, this was considered an expenditure transfer. The fourth budget execution event actually reduces budgetary resources, the rescission. GAO's glossary defines rescission as legislation enacted by Congress that permanently reduces budget authority. Rescissions may be enacted as a specific amount for a specific account, like these examples. Or they may be enacted as an across-the-board percentage affecting all accounts in the bill, as this example does. Or the rescission might cut particular costs in one organization, like this example reducing CDC's contracting and administrative costs. The important thing to remember is that in every case, this budgetary event reduces your resources. This is a nice segue into another event that we should discuss before we leave the Establishing Budgetary Resources section of the budget execution events: the Treasury Warrant. I have not included it in the list of budget execution events because it's not technically a budgetary accounting event. It's a proprietary accounting event. If you would like to understand more about this distinction, I recommend the Introduction to Budgetary Accounting video. The Treasury Warrant is an important event to be aware of related to resources appropriated from the general fund of the Treasury. It was mentioned earlier that we receive most of our spending authority from appropriations. While it's the Appropriation Act itself that conveys the authority to enter into obligations, the Treasury Warrant is the official document that the Secretary of the Treasury issues that establishes the amount of money authorized to be withdrawn from the Treasury to pay for those obligations. The Treasury Warrant is a lot like a deposit into your bank account. This deposit is referred to as fund balance with Treasury. In addition, if funds are rescinded by Congress, Treasury issues a negative warrant to remove this amount from your bank balance. So you can see that Treasury acts as our banker. They establish our bank accounts and they keep track of all payments and collections into those accounts. The Treasury Warrant is issued by Treasury Appropriation Fund Symbol, or TAFs. By using the TAFs, Treasury establishes the amount available, the period of availability, and by reference back to the Appropriation Act, the purpose of the appropriation. This is a warrant for fiscal year 2012 for CDC accounts. Let's quickly review the composition of the TAFs that was covered in the introductory video. The first two digits, 75, the zero hadn't appeared yet in 2012, identify the account as belonging to HHS. All HHS TAFs begin with 75. Each federal agency has its own unique code that identifies them. Homeland Security is 70, Treasury is 20, and so on. The last four digits refer to the Treasury main code, and these samples tell us they belong to CDC. We can confirm the ownership of the TAFs by consulting Treasury's Federal Account Symbols and Titles, or FASTbook. Note, for example, that the Treasury main code 0951 is CDC's Immunization and Respiratory Disease account. The remaining part of the code tells us how long the funds are available to obligate. Here we see the 12s indicating the funds were available for only 1 year, fiscal year 2012. Here we see samples of multi-year accounts, and here is a no-year account. Here's how we can see the relationship between the appropriation language and the amounts in the Treasury Warrant. Here is $579,375,000 warranted to the Immunization and Respiratory Disease account, TAFs 75120951. And here is $1,105,995,000 warranted to the HIV/AIDS account, TAF 7512-0950. This is an example of negative warrants based on a rescission enacted by Congress. Note the appropriation warrant type is rescission. Note also the amounts are negative. When combined with the original warrant, these rescission warrants have the effect of reducing the amount available in the account. This warrant reflects the Section 222 rescission we saw previously. Unless you have access to Treasury's GWA system, it's difficult to get copies of Treasury warrants, but you can get relevant Treasury warrant information from OMB's budget reports. Here's a sample of the FY 2012 report that reflects the sample rescission warrants we have been looking at. Note the TAF's format is slightly different from the warrant with the fiscal year at the end. This reflects the OMB influence in the report. Note also the stat reference to the law.
And here's another example of a rescission in the OMB report.
Let's summarize where we are so far with a simple example. We first receive an appropriation for $10 million. This is an example of budget execution event number 1. We have $50,000 in spending authority from offsetting collections because we've entered into a reimbursable agreement with another agency to do some work for them. This is an example of budget execution event number 2. Under the Secretary's 1% authority, we receive a non-expenditure transfer of $40,000. This is an example of budget execution event number 3. And finally, the Congress enacts a 0.2% across-the-board rescission, reducing our resources by $20,000. This is an example of budget execution event number 4. It's important to note that each event is separate from the other. In budget execution, it's important to properly identify each event so that they are correctly accounted for. When we tally up all our resources, we find that we have a total of $10,070,000 in budgetary resources to spend. This is the end of Module 1. By now, you should have some understanding of 4 major budget execution events and how they affect the establishment of resources: the appropriation, spending authority from offsetting collections, the non-expenditure transfer, and the rescission. In addition, you should have some understanding of how a non-budgetary event, the Treasury warrant, fits into the process. The warrant establishes the fund balance with Treasury for each TAFs, thereby setting a limit on how much can be paid from the account. We won't be including the Treasury warrant as one of our 11 major budget execution events because, as I mentioned previously, it's a proprietary and not a budgetary event. So, even though Treasury, as our banker, keeps track of all payments and collections, they have nothing to do with controlling obligations. That brings us to the next set of budget execution events: controlling and distributing funds. And that's the subject of Module 2.
Congratulations, you've completed Module 1. Next up, Module 2.